Hello, everyone. I'm really happy to join you today. And I will talk about my project. And basically, the passion for my project and my health equity project started very long ago after the tragic death of my father. A very long time ago, I came back to Sudan and I decided to pursue medicine as this was his wish that I become some sort a famous doctor. But coming back from England and comparing the healthcare system in UK, which was efficient and quality care was being provided, comparing it to what was happening in Sudan, I was a bit disappointed. I was thinking, can I actually help reform the healthcare system? At some point in life. But I continued and pursued medicine as my career. And I realized as I passed from the third grade to a third year medical school to the fourth year, we started going into different shifts and different disciplines, and we started going to the hospitals. And this is when I realized that, oh my God, those hospitals have very poor healthcare service. And I could see that patients at some point were lying down on bed sheets that were stained. The infection control procedures were not well implemented, and sometimes there weren't any infection control procedures in place. And I realized that I do have a lot to work on in the future. They started thinking that the best way to do that is through public health. But the story that really changed the way I think was when I met a child who was in the pediatrics ward, and that child was deaf and mentally retarded for one simple reason, that mother stayed home for 7 days with that child who had high-grade fever and did not seek any healthcare advice or medical advice, just because her husband and the father of that child was farming in another locality. So that delay cost a lot, and this child is going to be mentally retarded for the rest of his life. So I thought there is a very important impact of the social determinants of health, which we do have to look at. It's not just about caring and treating people in clinics. And I started thinking about public health, and as soon as I graduated, I looked for different colleges and different schools that have Master of Public Health. Back then in Sudan, we didn't have a university that provided an MPH program. But I found the Sudan Medical Specialization Board, which was starting the public health specialization. It's called in my country community medicine. But I was disappointed when I got so many people discouraging me from going into public health. And I remember I met my dean at an event, and enthusiastically he asked me, by now you do definitely know what you want to do in life. I said yes. I was so proud. I'm going to do public health. And he stepped back and he looked at me. He said, Sara, firmly, you got distinction in surgery. You're a smart, clever lady. Why do you want to do public health? And I thought, I was so disappointed. Why? And I asked him, is it people who are not clever that go into public health? He said, yes. And he said it sharply. He said, yes, they're not. Go and look for something else. If you don't want to do surgery, go and look into any other clinical disciplines. So I thought, okay, he might be right. Let me do obstetrics and public health, and those two can merge beautifully together. But then I had my family who were saying, no, you shouldn't do obstetrics. It's too stressful. You're not going to have time for your family. But then I pursued public health, and as a result of not doing what I wanted, and I had that passion for obstetrics, I went into so many different specializations. So I specialized in microbiology, and I left it. I dropped it. Then pathology, and I dropped it. Then internal medicine, and I dropped it. And I settled for dermatology. And this is how I started working later on, both public health and dermatology. So after a 30 years dictatorship regime in my country, which was overthrown, I was part of the new civilian government. And I was appointed the Director General for the Ministry of Health in a state, in the White Nile state, which is basically my state where my family come from, and it's very close to the capital city. So becoming a woman leader in a state that I belong to and I can help my family, it was a dream come true. And to participate in reforming the healthcare system and to be able to work and actually strengthen the policies that were weakened by the previous regime was actually an exciting journey. But I soon realized that was very much challenging and actually much more difficult than I actually thought. And during my visits to different areas and localities in the state, I realized how the primary healthcare system was not working. There's a foundation we had to do a lot of renovations. We had issues where primary healthcare centers used to be opened based on the tribal affiliation and at the same time based on the community affiliation to the previous regime. So you would get different primary healthcare centers in one area and they're not all functioning. So, but the story that really made me pursue the project and start thinking about it was when I met a few people in one of the villages, and they were telling me their story that a few weeks back before my visit, they had an 18-year-old lady who died during labor. And again, they had only one village midwife who was away that day, so they had to take her on those muddy roads. And it took them at least 2 hours. By the time they got to the hospital, she was dead. The baby died, definitely. And she had, because early marriage is very common in rural areas, and she already had one child. So you can imagine the impact on that family. So looking at the context of the White Nile state, we had early marriage, we had different social determinants which had to be changed, and at the same time there was poor surveillance system, water and sanitation was a problem. The state is always prone to different epidemics. We've got hemorrhagic fevers, we've got the cholera outbreak, which is there on yearly basis, and then there was the COVID pandemic, and at the same time we've got a very high number of refugees, which was also a bit challenging. But and they started reforming the healthcare system using the WHO 6 building blocks. And at the same time, I realized even though we're starting our reform, there's still need for reform in the rural underserved communities that to some extent we had very high mortality and morbidity. And again, the quality of the healthcare service in those areas was very poor. And I also looked at the culture, which was also affecting, and the religious background, which was also affecting those communities. For example, females would not be allowed to seek healthcare service unless they take permission from a father, a husband, or some sort of person, the head of the family, who's always a man. So I drafted a concept note and I shared it with a few organizations. And the goal of my project is to improve health equity through performance improvement among primary healthcare workers who are working in rural communities. And at the same time, I wanted to empower women with knowledge to increase their health-seeking behavior in rural communities. We drafted, I found a very good team, health promoters. At the same time, I had physicians who were on board. This was the core team who drafted the work plan. And then we drafted the budget, and we had planned, we met with the donor organization, international and national organizations, to help us execute the project. I also looked at public-private partnerships, which was also very important. And we thought of they can fund, and at the same time, they can also provide that technical support. I had meetings with all stakeholders, and especially because when we come to work on women empowerment, we would need community and religious leaders to be on board, because usually people will feel, men especially, will feel a bit intimidated that those those women will have knowledge and they will not be able to control them anymore. And I found a very good religious leader who has a bachelor degree. He's not just a normal religious leader who was on board. And we started working. Unfortunately, after 25th of October, there was a military coup. And everyone was dismissed from their post. And I thought that was the end of my project in the public sector. But after a few days, I found a donor organization who I was already in contact with before the military coup that could help fund my project, but I had to split it into two different projects. So the first objective was to do that capacity building and to improve the primary health care cadre in their capacity and to improve their performance through training. And I found a second national organization who can help me with the women empowerment courses. And I was happy that I got to see that I can work outside the public sector. So what we did was the national organization, we developed reproductive and child health courses aiming to increase women's health-seeking behavior and to manage certain diseases at home like dehydration and diarrhea. We also targeted economically disadvantaged women and we empowered them with providing them with small income generation projects, and we train them and we follow them to make sure that the project is sustainable. And the donor organization, we developed training manuals for medical assistants, and we looked at task shifting since we didn't have enough doctors to work in those primary healthcare centers in rural areas. I learned that you need to believe in yourself as a result of this fellowship and what happened in my project, and to keep your vision as your guiding candle that will pave your way forward. Staying agile and the ability to be flexible, to adapt to new situation, any new situation that you might encounter, and think quickly and anticipate what might happen and manage situations quickly. I also learned that scenario planning is really very important, and you have to learn how to plan quickly based on the new scenarios that you're facing. Staying resilient and motivated was an important factor for me. And just let your passion guide you both personally and professionally. And the last thing I would want to share with you is that you don't need power to be a leader, which I thought that you need power to be a leader and to move your projects forward. I realized you don't, and you can actually work outside the government, but all you need to do is have the power and skill to influence people and have followers who believe in what you're doing. I'm grateful for the fellowship program, who believed in me and believed in my project and continued to support me through the project at all stages, especially after the military coup when everything was collapsing. I'm also happy that I had an excellent mentor who supported me technically and emotionally during that military coup. And I was always scared that since I was also a politician, I might be in jail soon. And I'm also happy that I met you guys, and I know you and will definitely connect at some point in life. And I was really happy when you shared your stories. They gave all of us different insights on how to move on with our challenges. Thank you.